Thanks to an Epoch Times Freedom of Information Act motion, Americans now can see firsthand the U.S. Centers for Disease Control and Prevention, the CDC, internal documents showing what many liberty backers have known since 2020. The federal government has been breaching the Fourth Amendment, obtaining medical data without getting public warrants and tracking citizens for years. Hi everyone, I'm Gardner Goldsmith for MRC-TV, and here's the story. Zachary Stieber reports for Epoch Times, quote, medical codes introduced during the COVID-19 pandemic show when people are unvaccinated, as they use the term, or undervaccinated for COVID-19 are being used to track people, the top U.S. public health agency has confirmed. The U.S. Centers for Disease Control and Prevention, CDC, made the confirmation in emails that the Epoch Times obtained through a Freedom of Information Act request. The CDC had said in documents and public statements that the goal of the new codes in the International Classification of Diseases (ICD) system was to track people who are not immunized or are partially immunized. Besides the underlying defiance of the U.S. Constitution presented by the very existence of the CDC, one also might notice that the bureaucrats used terms such as immunized, which is almost quaint in its inapplicability since the mRNA jabs proved to not provide immunization against any strain of COVID-19 for which they were used. And of course, we see the errant general application of the word vaccine to apply to what is instead a ribonucleic acid manipulation serum. Adds Stieber, quote, the CDC now says it does not have access to the data, but that healthcare systems do. The ICD codes were implemented in April 2022. However, the CDC does not have any data on the codes and does not track this information, CDC officials said in the emails. The codes were created to enable healthcare providers to track within their practices, the officials added. The emails were sent to news outlets. The CDC has not answered queries from the Epoch Times about the codes, which the CDC added to the US ICD system in 2022. But the history of the codes is complex and very shadowy. Quote, the CDC proposed the codes in 2021. There has been interest expressed in being able to track people who are not immunized or who are only partially immunized, Dr. David Berglund, a CDC medical officer, said during a meeting about the proposal. One code is for being unvaccinated for COVID-19. Another is for being partially vaccinated or not having received a primary series of COVID-19 vaccine. Curiously, in a February 23, 2023 CDC letter to a USA Today reporter and featured by the Epoch Times in Stieber's report, a CDC employee claims that the ICD codes are created by the World Health Organization, the WHO, and that they were, implemented, as they say, by the CDC. So there appears to be an added layer of unconstitutionality and an additional use of taxpayer funds used by the CDC and also the extra funds handed to the globalist WHO. But as far as the general coding and tracking malfeasance goes, well, many people knew this was coming because in December of 2020, I reported on the news that the CDC planned to do just that, and that they claim the power to do so because, of course, of the 1996 HIPAA statute, aka the Health Insurance Portability and Affordability Act. As I noted then, and have done numerous times since, HIPAA used federal sleight of hand to claim the statute protected your medical privacy, when in fact, between pages 76 and 94 of the statute, it claims for the federal government, specifically, by the way, for the head of the Department of Health and Human Services, the power to assign an ID code to anyone who visits a federally tied medical center, which is pretty much all medical centers if they take Medicare or Medicaid, and then to collect that personal information anytime the feds want to. Stiebert notes that the CDC claims it currently does not have access to the data, but the CDC isn't offering the full picture. It can obtain the data anytime, to any degree. It has to be able to do this, or the assignment of individual health codes to all of us is useless. All codes must be tied to real people, and all real people can have their medical records accessed according to HIPAA. Reports Stieber, quote, all healthcare entities covered by the Health Insurance Portability and Accountability Act must use the U.S. version of the ICD. The U.S. version is updated at least once a year. Coded ICD data from providers enable public health officials to conduct many disease-related activities, according to the CDC. Purposes include enabling a doctor seeing a new patient to easily retrieve the patient's medical history. It's easy to assume that many Americans sign the ubiquitous HIPAA release form at their doctor's office, thinking it gives permission to the office to share their info with health insurance and with other offices in case of emergency. What most of that same American population have not realized or understood, despite warnings from me and other libertarian-minded people, is that by signing that document, they grant permission to the feds to take their data without a warrant. It would be nice if we were free to disconnect from all of it. It would be nice if the feds bothered to operate by the Constitution they claim to uphold. But of course, we've got neither right now. What we've got is each other. Thank you for joining us here on MRC TV's video presentations on Rumble, on YouTube, in Facebook, on TikTok, on Twitter, in Parler, and so many other places. It's great to know that you're here, one and all. And please remember, you can find us at MRCTV.org, MRCTV.org. While you're there, please consider donating to the Media Research Center. I can be found over on Gab as @GardnerGoldsmith and on Twitter as @GardGoldsmith. And I welcome all of your comments. I'll see you at Rumble, where we are not censored. For MRC TV, I'm Gardner Goldsmith.